Welcome. This is Tracking Pandemics Module 1.2, Terms of Importance. In this module, we'll go over, as the name suggests, a few of the terms that we're going to use throughout the semester, and we'll define how we're going to use them. Let's get started with some of the basics. First, the word outbreak. We see this word a lot thrown around in popular literature, news reports. It's a very generic term for the appearance of an infection in a population. Now, often it's used to refer to a new infection or a new population being infected, but this is not always the case. We will also use it as a catch-all term in this class. Another basic term that we'll see a lot this semester is epidemiology. Epidemiology is the study of patterns of infection within a population. Here I'm showing just one example of data that can inform patterns. So we would call this epidemiological data. This is the number of hepatitis A cases in a particular population. Here it's the Marshall Islands over a particular time period from September 2016 to July 2017. Again, get used to hearing these qualifications on data. Where is the data collected and how long the data is collected are two important parts of epidemiology that we'll see. Here in this graph you can also see overlaying some what we call metadata, or important events that might affect the underlying pattern. For example, instances of vaccination. Here we see where different populations were vaccinated over this time period. And then we can see the effect of those vaccinations on the patterns of infection. As a general reminder, data collection, data integration, these are the cornerstones of epidemiology, and they rely on data that is as complete, as accurate, and as unbiased as possible. Another basic term that we'll talk about a lot is the term model. Model is a simplified representation of a complicated phenomenon or event. Again, this is a very broad term. The type, the size, and the complexity of a model depends on the reason that you're building the model. So we see lots of different models, some of them very simple, some very complicated, some very long-term, looking at a phenomenon that may last months or years, and some are very short-term. Regardless, the fundamental goal of any model is to faithfully represent this phenomenon or this event with as few parameters as possible. In other words, more complicated is not always better. We're going to be seeing a number of terms. Here I've collected them together as the demics. The first term we're going to talk about here is endemic. Endemic refers to an infection that's present in a population at some consistent level over a period of time. To put it another way, an endemic infection is one that recurs or occurs within a population over time. We often use the term endemic to refer to infections in particular geographical areas. For example, Lyme disease is now endemic in the state of West Virginia, which means it is persistently here year after year. The number of cases of Lyme disease may change, but the presence of the disease is here over time, so it is endemic. In this graph I have on the slide, this is a graph of reported number of smallpox infections broken down by world region. And if you take a look at this graph, you can see that it is dominated by infections in the blue graph here. We see very few smallpox infections post-1966 in North America and Europe, as vaccination and other intervention methods all but eradicated smallpox from these regions. However, we still see smallpox endemic to 31 countries and territories around the world, and those are dominated in particular by countries and regions in Southeast Asia, which is the blue here. As with outbreak, as with most of the terms we're discussing today, we'll often hear endemic used to describe non-infectious diseases as well, such as heart disease. The second in this category is epidemic. Epidemic is a sudden burst in the number of infections, or the rise and fall in incidence following the introduction of infection into a population. Again, as with all of these terms, we usually discuss this within a limited geographical range. For example, in this graph, we see the weekly number of confirmed flu cases in Alberta, Canada, over a particular flu season from 2003-2004. Here's the rise in late September, early October of cases. It peaks somewhere around November 1st and then declines again into the new year. This is what we would call an epidemic curve. Finally, the third in this category is pandemic. Pandemic is an epidemic that occurs worldwide. So again, our epidemic, we usually refer to these as geographically isolated. For example, we have a flu epidemic in Alberta, Canada. We may have a similar epidemic in Northeast United States. They are going to be following different dynamics, and so we would usually term those as separate epidemics. A pandemic is a global phenomenon. It's an epidemic that occurs across the entire globe, or nearly the entire globe. The WHO has specific considerations for when they declare something a pandemic. Those considerations are wrapped up in public health response, economic response, measures that can be taken. We're not going to concern ourselves with that definition here, but the more generic definition of pandemic, that is, an epidemic that occurs over a huge swath of the globe. For example, COVID-19. Here I'm showing a graph of confirmed cases of COVID-19 by country across the world since the start of the pandemic. And as you can see, the vast majority of these curves are trending upward over time. There are a few examples of regions or countries that have very low incidences of COVID. This does not mean it's not a pandemic. So it doesn't have to be 100% global coverage. One thing we're going to explore in this class is how graphs like this one and the last two I showed you, and in fact, how our entire public health response relies on the underlying data that we collect. And we're glossing over it in this introductory slide, but things like confirmed cases are a little more complicated, a little more sophisticated underneath the hood. We're going to look at what it means to have a confirmed case versus an unconfirmed versus a probable case. How those definitions change the way the data is collected, change the way the data appears in our models. And in a lot of cases, those differences can be crucial to how we interpret what's going on. So, when is the occurrence of an infection considered an outbreak or an epidemic or a pandemic? And the answer is, it depends. And it's fuzzy. And a lot of times we will see these terms used somewhat interchangeably. In fact, we will use them somewhat interchangeably. But here are some examples of where those lines tend to be drawn. In the red here we have an outbreak of Ebola in the Democratic Republic of Congo. This lasted from May to November in 2020. A little over 100 people were infected. This was geographically constrained, it was fairly small scale, and it did not last a very long time. We might term this an outbreak. As in contrast, I've noted two smallpox epidemics in purple. Here's one in Boston in 1721. Over 6,000 people were infected, which back in 1721 was a significant share of the population of Boston. And in the Northwest United States, Washington State, primarily in the 1770s, there was another smallpox epidemic that cost the lives of 28,000 people. Again, a significant fraction of the population. These were longer, these were larger epidemics or outbreaks of disease, and so we would term these an epidemic. And finally, the pandemic, global SARS-CoV-2 pandemic, COVID-19. You can see the scale is much larger in terms of case rates, fatalities, and global spread. Okay, let's talk about some of the timings, some of the periods that we're going to be discussing and using as we start to explore models of infectious disease, how we predict and track these. So first, incubation period. Incubation period is just the time between when an infection occurs and when we see symptoms of that infection. So here for the next slides, I'll be showing these on a timeline. Here at the start is the infection, and then the white arrow indicates time. The pink arrow indicates when we see clinical symptoms. Those can be fever, headache, nausea, coughing, shortness of breath, whatever the symptoms are for a particular infection. That time period is often called the clinical time period, when an individual has symptoms of a disease. The time before that, before they're symptomatic, but they have been infected, is called the incubation period. The next time period we're interested in is called the infectious period. This is the time period during which a person is infectious, is able to transmit an infection to other people. Here I've concluded on the graph with latent phase. So here you can see the infectious period in red occurs before clinical symptoms appear. This is true of many infections, including COVID-19. We'll talk about this period in just a minute. The latent phase is the corresponding part of the incubation period where a person is infected but can't yet transmit that infection to others. Perhaps the infection hasn't progressed far enough, perhaps it hasn't moved to the appropriate spot in the infected person's body. These phases are highly dependent on the infection we're talking about. So every different disease will have different incubation, infectious, and latent periods. One of the struggles with novel infections like coronavirus, like SARS-CoV-2, is determining the duration of these phases. And the third period we're going to talk about for now is called the subclinical infectious period. That's this yellow phase up here. That's the time between when a person is infectious and when they start showing symptoms. As we've seen with COVID-19, but we see with other infections, some diseases can be transmissible from person to person before you see any symptoms of the disease. And in fact, some can be transmissible among people who never show symptoms. That's why we care. We care particularly about that subclinical infectious period, that time between when a person can transmit the disease and when they start showing symptoms. And we care about that period in particular because most of the interventions that we rely on for public health response are based on isolating people who have symptoms. If you're sick, you stay home. If you're sick, you stay away from people. You go to the hospital and you're isolated so that you don't transmit that disease. If an infection can be spread by people who don't appear ill, or at least don't appear ill yet, those people tend not to isolate themselves, and so the spread of the disease is much greater. So infections with extended subclinical infectious periods, such as COVID-19, these are particularly difficult to control with standard public health measures, like isolating people who appear sick. Okay, just to finish up, the last two here, a carrier. A carrier is an individual who is shedding an infectious agent but shows no clinical symptoms. So a person in that subclinical infectious period, in that gold period, is called a carrier. You'll often hear carrier referred to as asymptomatic individuals, these days in particular. They're essentially interchangeable, although they're not exactly the same. Asymptomatic can refer to infected individuals in the latent phase as well. It's a more generic term than a carrier. We're not going to concern ourselves with those distinctions. What we are going to concern ourselves with, however, is categorizing individuals in a population as accurately as we can to inform models. One of the most basic, one of the most earliest models that was developed for infectious disease tracking is called the SIR model. SIR stands for susceptible, infectious, and recovered. And it refers to these three groups of individuals in a population. Susceptible being someone who can contract the disease. They have no immunity against it. Infected, or infectious, being someone who has the disease currently, whether they're pre-symptomatic, asymptomatic, or showing symptoms. And recovered is the group of people that have had the disease and recovered, so they have some level of immunity to that disease. The SIR model that we're going to look at during this class uses the rate of movement of individuals from one class into another, and how those rates of movement can inform how a disease is spreading and can help us predict how it might spread in the future. We'll learn a lot more about the SIR model and related models later on. That's all for this module. Thank you very much.